Why are blood sugar levels important for babies? So, glucose is actually the primary source of energy for the brain. So, it's very, very important that we check any babies who we deem to be at risk at birth and check their blood sugar levels and act appropriately based on those numbers. So, who is at risk? Which babies do we need to be checking blood sugar levels on? So there's quite a few. So we would check blood sugar levels on any infants of a diabetic mom. So that doesn't matter whether they are gestational diabetes or a type 1 diabetes, insulin dependent ladies. We would check those babies' blood sugar within the first 2 hours of life. Now, a good blood sugar that we would like to see at that time period is 2.6 millimoles and above. So that you don't need to remember these numbers, but that is the number that we as nurses and midwives will be looking to achieve. Now, other babies that are at risk are small for gestational age babies, so babies that their birth weight is a little bit lower than what we would expect, or on the other hand, babies who are large for gestational age, so a lot bigger than we might expect. So we would check those babies' blood sugars again within the first 2 hours of life. We also check blood sugars on babies who have received resuscitation at birth because they will use a lot of energy in that process. So we want to know that their blood sugar levels are actually okay as well. We will take blood sugar levels on any baby who is lethargic, perhaps not feeding well, or who is cold. When you're cold, you actually use up your energy stores, your glucose level stores, to keep yourself warm as a baby. So those are the babies that we would be checking for blood sugar levels. So it's very, very important that we treat these levels. So sometimes we can treat with just feeding. So if you're breastfeeding, we might get you to express and we can give the baby a little bit extra milk. We may need to give some formula to your baby. We may need to actually medicate your baby. So we might need to give them something called glucose gel, which is a sugar-based gel that we just rub into the gums and it's absorbed through the tissue, and that sometimes brings up the levels enough. If your baby's blood sugar level is very, very low, then sometimes those babies do need to have some intravenous glucose just to get their levels up. So yes, blood sugar, really, really important. We do not screen every baby, every term baby, but we do screen those with those risk factors that I've just identified.